Welcome to The Individual Animal, a podcast about dogs, people, and animal sheltering. I'm your host, Nikki, here with my co-host, Bernice. How you doing today, Bernice? I know. The weather is really nice. My allergies are bothering me, and I'm okay with that today because we finally have some nice weather. I think I'm going to mow my lawn after work today because that's got to get done, and it's going to rain the rest of the week, so. So we talked to Amy Marder, Dr. Amy Marder, who is like a legend for me. So that was really exciting. Because... Yeah, that's why she is a legend, because I hear about her, since I've known you, I've heard about like your experiences with her and how you got started, and watching you work dogs is pretty amazing thing to watch. So like it's always like, wow, Amy was a part of teaching you all those things, even though she was like, you're a natural, which I'm sure you are too. But and because I talk about breed labeling and stuff, and occasionally the American shelter dogs come up, which she started in I think 2008, which seems like it's not that long ago, but I think when we do the math,
like forever.
It's a pretty long time ago. It's funny how things just get further or seem closer that are further away when you get older. So she's always been an idol in that regard with not labeling dogs and calling them American shelter dogs, and we've moved from that to other things, and but it was really cool to get to talk to her. So
yeah,
I was excited. Nice. And then so right before we got on, I went to look at her, like I do with most guests. I'll go and check out their biographies and stuff, so I'm prepared. And I was like, whew, I don't know if I'm gonna be able to read all this stuff.
Can I say all
How am I gonna remember all this stuff? So I've got like the Spark Notes version, and I'm going to link her full laundry list of things in our show notes. But she is currently teaching classes at the University of Florida's Shelter Medicine, the online program, which is really cool. That program, so many different courses they have for that program. I think it's really cool.
Yeah, it's pretty amazing.
Yeah, I did one on breed labels a couple years ago. And I know we talked to Caitlin Quinn, who does a one on marketing for that program. And then Amy does one on behavior and I think pet health. But both of those classes are in the link. I'm gonna link you guys to. But what a great program that is. I'll link to the program as well. And what else does she do? She also teaches classes at the Cummings School of Veterinary Medicine at Tufts. She, throughout her career, she's a veterinarian and a certified applied animal behaviorist. So that's like a pretty pretty great title to have. A lot of different things to go to school for to get those titles. But so throughout her career, she's helped dog owners and their pets with behavior advice. She served as the vice president for the behavior medicine at the ASPCA in New York City. And while she was there, she studied behavior evaluations in shelter dogs, which is what we talked to her about today. She also acted as the director for behavior services for the Animal Rescue League of Boston. She also was the director for the Center for Shelter Dogs. She's written 2 books.
She also probably, maybe it's not in that bio, the veterinary behavior clinic that I worked for is her clinic, New England Veterinary Behavior Association.
Okay. All right.
So that's her private practice.
Okay. And then she recently published an article on food-related aggression in the Journal of Applied the Journal of Applied Animal Behavior Science. And that's all I got. That tiny little bit.
That's it?
I mean, I don't mean to laugh. This is a very serious, crazy academic resume she's got. So it was definitely very cool to be able to talk to her today.
Awesome.
Yeah.
Yeah.
So, okay, I'll shut up. We'll talk about every dog is an individual. You know, I have to tell everyone that. It's like, you know, people don't even realize that. They think a dog is a dog is a dog is a dog. You know, no way. So, anyway, okay, got it.
Awesome.
All right.
Okay, we're starting. Okay, go ahead.
Great. So we wanted to talk, Amy, about behavior evaluations, and I know you know all of the history of behavior evaluations.
Yeah, you know,
So
it's no, and also, you know, I teach that Florida course, and Nicole spoke to us, and we have this whole thing on behavior evaluations. I mean, we do the flipping the coin, and which of course Gary and Janice published, and they read all that, and they review all that, and they know about all that, and everyone wants to do a behavior evaluation. They still want to do behavior evaluations, and so I really think that, and with all this after all the matchup too, you need to get to know the dog, and because every dog is an individual, right? You really need to know. You know, so many of these dogs are fearful, and what are you going to do for that dog that is very different than an outgoing, I can do anything dog, and they need help. They need help adjusting to their lives. And in order to find out how they need help, we need some kind of, with uneducated people that are trying to help, they need to have guidelines. And the behavior evaluations, although they're horrible things because they're scaring dogs, but we need to do something for them to understand that every dog's an individual and needs different things.
So are you saying that the behavior evaluations work to show you more individuality in the people, or are you saying the opposite?
I'm not sure. I'm right before I left the Animal Rescue League, I took Matchup 2 knowing that all of those tests only gave you information for they said they gave you the same information. Like if you had a fearful dog, the dog was fearful in a lot of these tests. So I ended up just saying we only need to do like 5 tests, 4 tests, and don't call them tests. So, and you could do all these methods of observation, either on walks, during a medical exam, during vaccinations. You could get that same information to know what the dog would benefit from. So it doesn't have to be bring the dog into an individual room and then the room has to be this size, and you need to poke the dog with the artificial hand, and so it's what I put together was a much easier observational method. And I think it's important that you do it soon after the dog comes in. Maybe that means something, maybe it doesn't mean anything. And then do it a few days later after the dog acclimates to the environment. So, yeah, but I think you need to do something formal to know what's going on with the dog. So, like Pogo, he's still there. You know, he was shipped to me, or he came on a van, not a van, like a little car thing, like an Amazon truck from, no, that's what it looked like, from Kentucky. And he didn't really get to what he was really like for a month. And he keeps changing, and I'm not doing a whole lot of training with him. And he keeps changing who he gets attached to, where he likes to spend his time. So I think it's important that you evaluate or you observe these dogs, like maybe when they first come in, and then maybe once a week when the dog's in the shelter. If it's a very simple test, very simple. I'm going to call it a test because I don't want to test these dogs. It's learning about the dog on a weekly basis. So
That makes sense.
yeah, right. Well, Bernice, working with all the dogs you work with, that they change, right? Over time. Of course. There you go. Okay. Perfect. Yes. Right.
Yeah.
And
then they change when they have an attachment to somebody.
That's exactly right. Yes. And they change according who they're with the individual. Yeah.
Yep.
And then they'll probably change again somewhat when they get into the new home, and then they go through the change process as they acclimate to the new home. So, yeah.
And then they turn 5. I usually like that change, but it's definitely another change.
That's right. You got it. Yes. Right. So, and I think people need guidelines because, again, they think, in all my behavior clients, right? They think, in general, they think a dog is a dog is a dog is a dog. And why did he like my last dog? My last dog used to be like this. And why isn't he like my last dog? Because he's got a different set of genes, and because he had different early experience. He's in a different environment. So this dog's different.
You worked with Bernice for a while.
I did work with Bernice.
People might not know that.
Yes. Well, Bernice was a client of mine.
Yep.
With Dixie, and I was so impressed with Bernice, I have to say. And then we did that.
You did the Pitbull evaluation. So it was through evaluations.
Was it through the Pitbull evaluation? Was it?
No, I already came to you because Dixie had separation anxiety.
Right, that's right.
And then I followed the instructions.
Yeah, right. Good.
And it worked.
So it was good. Instructions.
It worked.
Yeah, right.
And then I had wanted to work with animals, and then you had me come to the I was sort of more volunteering in the beginning.
Right, that's right.
And then
Dixie, because of Dixie.
Yep. And then you had me come.
We have a picture of Dixie. Dixie was just such an amazing dog. So yeah, and beautiful dog. Yeah. So she was amazing, and and then I had. Then, was it after I met Jane in New York that I started doing the Pitbull presentations? No, I think it was before Jane. And then I started to do them in New York also. And then I think I bring you to I brought you every place.
You had me. We did the Tufts conference in Copley.
That's right.
And then we did something right at Tufts, not that long after.
And that was all put together by, was it Gary that did? No, it was Andrew Rowan. Andrew Rowan put them together. That was pre-Gary.
Yes, it was pre-Gary for sure.
Yeah, right. And then he put together these Pitbull things, or Pitbull's different. Right? Yeah. Yep. And so, right. That was a long time ago.
I'd love to see slides for those presentations from way back when.
I don't know if there were slides. What did you, at the ones I was at, it wasn't really slides. Like you talked, and then we actually did the evaluation. On the two that I went to, the one in Copley, you might have had slides at the beginning, and I was probably distracted because, at that age, Dixie was a handful. So for me to be in a big audience in Copley was a lot to manage.
You have a really great story about how Dixie was supposed to perform for that one presentation.
She was different at both evaluations, and it's funny because I don't know, she was younger in the first one. I don't know if you remember, Amy, when we were in Copley, and we gave her, I want to say Carmen, we gave her to one of your handlers to handle for your evaluation. I didn't handle her the first time.
Oh,
and she was great. She
Boy.
looked like this perfect, wonderful, amazing dog.
Right.
And then a few months later, I handled her because now I was working for Amy. I handled her as her owner. And when the threatening person came out, who was Carmen, who she loved, she lost her shit. Like, was so inappropriate.
Interesting, right? This is just,
Yep.
yeah, dogs' reactions depends upon the person, depends upon the person they're with. It's all, yeah, so evaluations are there.
They're there.
Right, yeah, right, yeah, right. And it's, yeah. Anyway, so that, thank you for bringing that back. That was a long time ago.
That was a long time ago.
Yeah, right, yeah.
Yeah.
So it was probably when I was 40 years old, right? No, I'm 70 years old, so it's a long time. I bet it was 30 years ago. Yeah. So, yeah. So, okay. So,
anyway, so.
Yes. But, you know, one of my interests when I was going through working at shelters and evaluating dogs after adoption, I was really interested in the change of the dog when they were in the shelter and how they were after adoption. First, I was interested in what the behavior problems, what did the dog show after adoption? And then I was also interested in what we see in the dog in the shelter. Does that behavior continue after adoption?
Yeah.
And what I found out, I did a very simple study on food aggression. So we have all these food aggressive, we had a few food aggressive dogs in the shelter. And was that dog going to be food aggressive after adoption? Now, food aggression, maybe thanks to who knows who, in the shelter, people were just slaughtering dogs for food aggression in shelters. And of course, me being a behaviorist, I go, why don't you put a dog to sleep for food aggression? You know, that's like something that's really manageable. And but according to shelters, they had so many dogs to adopt out that food aggression, they weren't going to take the chance. And so then what I did, my interest was looking at, well, does it go away? What happens with food aggression, which is a whole behavior problem that we didn't know much about. And so I did this little study and found out that it goes away in a lot of dogs. So it's and why does it go away? Because the shelter is a really stressful place. No matter what it is, that shelter, and I really didn't understand, or I didn't really get it when I first started. I try to reduce stress in the shelters, but I don't think I knew about the intensity of the stress in shelters for these dogs. And it's, yeah. So first, certainly a change in location, all these barking dogs around them, not being able to escape all these stressful things in the shelter. It's a very stressful place. So that I learned from that, and probably Bernice knew about it from the very beginning because she is a natural observer, and no, it's true. It's true.
It is true. It's like, I knew nothing in the very beginning. I just knew I wanted to work with the dogs. But
somehow, you know what? You just, it's like it went inside of you and you go, this is the way it is. So, yeah, she's a very good, yes. No, it's like, you're like Jane Goodall, with dogs. Like, yeah, right. Yeah. So, anyway, yeah. So that's, and so what I think is wonderful now, what's happening with our sheltering world is that we are now using foster homes as much as possible instead of putting dogs in cages. And I don't know, you can tell me, Bernice, or Nikki also, if anyone has done a study looking at the stress levels of foster homes compared to shelters. And I certainly think it's a better way to be, but just in common sense, just isn't it better for a dog to be in a home with other dogs and people that they just much better than being in a cage. So anyway.
Someone,
yeah, go ahead.
Nikki, what is her name? I'm drawing a blank here.
Lisa Gunter?
Yes.
No, it is Lisa Gunter.
Didn't she just do a study on that? I didn't listen to.
She did a study on the weekend fosters.
Okay.
Yeah, but I don't know
if that's what I'm thinking of.
Yeah. Okay. So, yeah. Okay. Yeah. You can get her on one of your podcasts.
We would love to. Yeah, yes. I think she's on the list.
Do it. Just do it.
The list to contact. She's great.
Yep.
Or just let her say that I recommended her. So sometimes, because I got her to come to Florida. So, nice. And she came to Florida. So, yeah. Nice. So, yeah. Nice. The other person who's wonderful is, Sasha Protopopova, she's got this, she's Russian. So Sasha, do you know her work? Her work is amazing. So yeah, I'll send you her information because she should do one. She's the best. Yeah, she's the best and she's a fantastic speaker. So yeah. See, I get all these people from Florida, so I've heard all these people already. So it's yeah.
Nice.
Yeah.
Are you currently teaching classes at the university?
Yes.
On the behavior evaluation?
No, on behavior in the shelter. Okay. So I have the elementary dog and cat behavior in the shelter, and then I have a more advanced course in this is real life. Here's a dog, and what are you going to do with that individual dog? So in the shelter. So I have 2 courses.
Oh, that
and I teach really with
interesting.
And yeah, it is. You might want to go for that. And I teach them with Leah Nettle, who is my assistant, who saw behavior. She has her PhD in crow behavior. And I met her at one of these animal behavior conferences. And she saw behavior problems with me, behavior cases with me, and then she went out on her own, and she's in Buffalo now. So yeah, so we teach the courses together, which is great. So yeah, you probably met her, Nikki, when you gave your lecture, Leah. You might have.
I might have.
You might have. Now she doesn't do all those little things, but she's got two young boys that take up a lot of your time.
Sure.
One is now 4 and one is 2. Yeah. So
wow.
Yeah. So anyway, so that's what I do for Florida. The Florida shelter medicine section is amazing. The people and the students come from all around the world. So it's pretty amazing. So, and Terry Spencer, who is the head of the whole course, is so, she's so knowledgeable. So yeah, I love doing this. It's nice because it's all online. The whole all the courses are online, and so it's great for me because I don't have to go anyplace. I just sit at the computer, right? Yeah. So, but it's really nice for to keep in touch with colleagues online, at retirement age. So it's just wonderful. So yeah. So that's what I do, and I'm also seeing behavior problems, but I'm seeing my behavior problems. I started seeing behavior problems all online during COVID, and we lost our office because they found a person, a physical therapist. They would pay more rent than we could pay, so we lost the office. And then I just started doing Zoom calls, and I develop relationships with the clients. You can develop relationships on Zoom, which is fantastic. And you can observe the animals, and you can do training with the animals online. And I find it better to see behavior cases online than I did in person. Like in person, you make the dog so afraid, and Bernice can tell you that the dogs are either so afraid or aggressive, maybe because they're afraid, and so you don't really learn anything about them. And but with Zoom, I can see the animals. I can see easily what they're like when they're left alone. I can see what they're like with all kinds of different people. Yeah, so I'm seeing behavior cases online. I'm teaching the Florida courses, and yeah, and I was writing a book review, which I never finished, for the shelter medicine behavior book, and so I'm busy.
Good.
Yeah. So, yeah, I like your shirt. That I have
All
one.
dogs are individuals.
I have. Yeah. You know what I love? Those glasses. And my sister wanted those glasses, and I said, I'm going to try to find them online, but you're not selling them anymore. The glasses. Remember the glasses? What's that?
We have.
She has a secret stash when you come in August.
So yeah.
You do?
Yeah, we'll get you some for your sister and for you.
Oh, well, that would be fantastic. Wow. Wow. Oh, excellent. All of mine are like they're losing their whatever they're made of, right? Yeah.
Yeah.
But
These
no,
actually
but I
are
don't.
the colored one too, so they look more like they have the.
Oh, I never
they're not
had
just
the
black
colored
and white.
ones.
Yeah, they're brand
They're
new.
really nice.
Right.
We got them just to have in house, like at our office, but we have an extra box, so we'll have to.
Oh, yes, send me a few. That'd be great. Thanks. You have my address. Wow, how exciting is that? That's very exciting. Good. Because I love this. And I've trained Effie, so he walks Poco, and then, he wears the shirt, all dogs are individuals. So yeah, he gets the message across. So
nice.
Yeah, right. Yeah. So it's just good. I mean, all people are individuals. Everyone's an individual. So the other one you might want to, maybe you could invite, is Alexandra Horowitz. So she's she's a fantastic speaker, and she's she was very good. She does a lot of stuff on cognition in dogs. So
cool.
Yeah.
We have her book in the
one. Yeah, I think she has a new book.
We do.
Nikki.
Okay.
Yeah.
Okay.
Right. Yeah. Right. So yeah. So in terms of my education at this point, it's just an easy way to get education. So yeah, through this Florida course, they offered me this position in the Florida course, and that was like, God came down and took care of me. So it's very good. So yeah, right, yeah,
nice.
So yeah, I figured God gave me the Florida course, gave me Effie, and gave me Poco, right? Yes. So I'm pretty good. That's right. Yeah, right. So yeah. So
I know it's not really in our wheelhouse, Bernice, but also Amy, your assistant that does the crow behavior stuff. That sounds
Leonetto.
That sounds really cool.
Okay, that's what she heard. Her. Okay, she could. Oh, she'll be there.
It'd be a little side.
Okay. Thing. Okay, her name is Leonetto.
It is the individual animal, not the individual dog.
That's right. Exactly.
I think crows is great.
About crows too. Yeah.
Crows. I love crows.
Yeah. Right.
Yeah. And I have to give you a quick shout out and a thank you. I was working on, I'm speaking at the Florida conference on breed labels next week. And I was just redoing some of my slides yesterday. And I was like, I get to say, this is not a new concept. Amy Marder in, 2008 was talking about American shelter dogs. So.
Oh, yes, right. I know that was the days, right? Yeah. Those were the days. Yeah. So that's great.
Yeah.
So what is the situation with the breed-specific bans?
Still on the decline, which is good.
Oh, good. Great.
I know
Excellent.
we've got the big XL bullies over in UK that were, it's really unfortunate. And I was just listening to a podcast the other day from somebody at the UK saying, it's really just the media. Nobody really wants this ban over here. So
what's going on in Australia?
No movement that I'm aware
No
of.
movement.
Yeah.
Huh?
So we're just trying to help the advocates when we can, where we
Sure.
can.
But man, I mean, certainly in the Northeast.
Yeah.
God, they're all mixes, So now I think it's even more mixes, than it ever was. So it's just like,
Silly.
I couldn't even tell you what's in them, but it's just they're just all over the place. So, but all the dogs were. Go ahead.
I was going to say, now we've got the insurance companies. States are starting to pass where insurance companies can't use.
Excellent.
Which is huge. Yeah, I think 8 states so far.
Wow.
Yeah. So that's really exciting.
And what about the DNA tests? Are they looking at the DNA tests?
No.
That's good. That's good.
Yeah, I hear that as much.
Good. Great. Well, that's excellent.
Yeah.
And Jane is back working with the Animal Farm Foundation?
She's doing more than she was for a while. Yep. Yeah, it's nice to have her.
Oh, that's great.
Want to add anything else behavior evaluation wise, Amy? Or are you?
Well, I think that my main thing is that every dog's an individual, and you have to look at each dog as an individual, not a dog is a dog is a dog is a dog, right? And also not even, so many people look at breeds, but there's such within breed variability. I think it's easier to look at a dog, evaluate the dog, and see the dog as an individual, not as a member of a breed. And then the other is that when dogs are being rehomed, when they are in a shelter, the shelter tends to be so stressful, it may bring out other behaviors that you're not going to see in a less stressed home. Another thing that I guess we didn't even go over is that when you're looking at a dog's behavior and looking at adoption, one of the most important pieces of information for one to collect is the behavior in the previous home, because the behavior in the previous home is most likely to correlate with the behavior in the next home. And they're still not getting the information of the behavior in the previous home, and it kills me. Even if they do get it, they don't give it to the new adopter. But it's very, very important to understand the behavior in the previous home. And then the behavior evaluations, I think we need to use a minimal number of observational tests, not the formal poking the dog but I think just simple tests or simple observational tests to look at how the dog is in certain situations. So it's not really a test, it's an observational. You have to vaccinate a dog? How did the dog do when he was vaccinated? How did the dog do during the physical exam? It's not poke the dog and palpate his stomach and pet him on his head. All those things happen. All those things happen when you're taking the dog for a walk or you're doing a physical exam. So I think that you might be getting as much information by just doing these observations as doing these scary tests. And so, but I do think these observations need to be done. When Gary and Janice, we didn't used to do anything, but I think it's important for us to be able to tell the adopter something about that dog. Yeah, right. Instead of saying, "Oh, just take the dog home and see how he is." I don't think that's the best way to go. So, right. So
thank you, Amy. This was great.
Okay, good. Well, I enjoyed it. I enjoyed seeing you. So this was very good, and I'm